Hurricane Helene came this past fall, and the responses in the community and the emergency response, a lot of these ERs got swamped with a lot of, and even just the commands that were supporting it, and in a variety of different healthcare ways. What's one thing, either a tool you could give to a leader today to support their team in crisis?
It's really interesting. West Point did a study, and they found that if you're, for example, in combat, in an extreme situation where a lot of the things I was talking about, establishing safety and being trustworthy and so forth, temporarily shifts so that the number one attribute you look for if you're in combat out with your sergeant or your lieutenant is competence. Isn't that interesting? So the important thing I would say is be competent in your discipline, because they'll certainly be looking for that in the medical field during those crisis periods. But the other part is, even though that's just a temporary period of an emergency reaction, what's the most important thing after that is the trust you've established with people, right? It goes back to that. So you have to bank the psychological safety and the trust building and those behaviors before the crisis hits. Make sure your competence is at the appropriate level,
Yeah.
right? So people don't get fearful, and then you're back to the normal situation.